Today we're going to discuss nervous system disorders. First, we have a cerebrovascular accident, also known as a CVA. An ischemic stroke occurs when the blood supply to part of the brain is interrupted or reduced, which prevents brain tissue from getting oxygen and nutrients. A hemorrhagic stroke occurs due to bleeding in the brain from a ruptured blood vessel. Some signs and symptoms of stroke include confusion, dizziness, loss of consciousness, seizure, facial droop on one side, drooping of one eyelid, blurred vision, a sudden, very intense headache, loss of bowel or bladder control, numbness and tingling on one side of the body, hemiparesis, the inability to speak, and elevated blood pressure. Okay, so this shows an ischemic stroke where there's an embolus that's blocking blood flow to the brain. This picture here shows a hemorrhagic stroke. So there's an aneurysm in the cerebral artery that breaks open, causing a bleed around the brain. The pressure of the blood on the brain causes brain tissue death. So this is just a little flyer that shows how to spot a stroke. They use the acronym BFAST. B stands for balance. So if a patient complains of loss of balance, headache, or dizziness. E is for the eyes. So if a patient complains of blurred vision. F is for face. If you see one side of the face drooping. A is for arms, and that refers to arm or leg weakness. S is speech difficulty. And then T is time to call for an ambulance immediately. Some guidelines for caring for a resident recovering from a CVA include encourage independence by using assistive devices as appropriate, promote self-esteem, encourage client progress, and encourage socialization, allow the client time to respond by providing ample time for tasks, assist with range of motion to maintain muscle tone and joint mobility, be aware of changes in or loss of sensation when providing or assisting with personal care, assist with nutrition as appropriate to maintain client weight and avoid constipation, do not refer to a specific side or part of the body as a bad body part, place food in the strong, unaffected side of the mouth when feeding a resident, and reposition every 2 hours. There's a phenomenon known as left neglect, and it describes a deficit in awareness that occurs following an injury to the brain's right side. The brain has trouble paying attention to things falling in the left hemisphere. So some things to report to the RN, any changes in level of consciousness, a change in the patient's ability to use a body part, a change in a degree of sensation, signs of dehydration or weight loss, and signs of depression. Parkinson's disease is a brain disorder that causes unintended or uncontrollable movements such as shaking, stiffness, and difficulty with balance and coordination. The resident will progressively deteriorate. Some signs and symptoms include uncontrollable tremors, mask-like facial expressions, drooling, rigid muscles, shuffling gait, and stooped posture. Michael J. Fox is a famous celebrity who suffers with Parkinson's disease. Some guidelines for caring for a resident with Parkinson's disease include assist with ambulation to prevent falls. When ambulating, encourage the resident to stand as tall as possible and pick up his or her feet so they don't drag. Allow the client ample time to complete tasks. Assist with ADLs as appropriate. Provide assistive devices to assist with eating. And encourage socialization. Some things to report to the RN regarding Parkinson's disease include severe trembling, severe muscle rigidity, mood swings, sudden onset incontinence, signs of dehydration, and signs of depression. Next, we have seizures. Seizures are caused by a short circuit in the brain's electrical pathway. This can be from head trauma, a brain tumor, fever, alcohol or drug use, or deficiency of oxygen to the brain at birth. Some signs and symptoms include change in level of consciousness, tonic-clonic muscle movements, and staring. If a resident has a seizure, you want to lower him or her to the floor and protect the head from injury. You turn the client to the side to protect the airway. You never put anything in the resident's mouth. After the seizure, assist the client into clean, dry clothes as appropriate, and be supportive of the resident to support self-esteem. You need to notify the RN immediately, report the time the seizure started, how long it lasted, and describe the seizure. Multiple sclerosis is a progressive disorder that affects the nervous system's ability to communicate with muscles and control movements. It occurs most often in young adults. Some signs and symptoms include numbness and tingling, extreme fatigue, muscle weakness, tremors, decreased sensation in the extremities, poor balance, difficulty walking because the feet drag, bowel and or bladder incontinence. Paralysis occurs in the late stages of the disease. Some guidelines for caring for a resident with MS. Assist with ambulation to prevent falls. Allow residents ample time to complete tasks and ADLs. Offer frequent rest periods during tasks and ADLs. Turn, reposition, and provide skincare every 2 hours. Assist with range of motion to maintain muscle tone and joint mobility. And encourage socialization to prevent depression. Some things to report to the RN are skin that is red, pale, or looks like the beginning of a pressure injury, joints that do not move as easily as they once did, complaints of burning on urination, frequency with urination, or urine that is foul smelling, and any changes in level of consciousness. Next, we have concussion, that is a banging injury to the brain. Signs and symptoms include headache, unequal pupils as seen in the picture, drowsiness, seizures, and change in level of consciousness. Next is a spinal cord injury, and that's damage to any part of the spinal cord or nerves at the end of the spinal cord. Some guidelines for caring for a resident with a brain or spinal cord injury include turning, repositioning, and providing skincare every 2 hours, performing range of motion exercises as ordered in the care plan, encourage independence with ADLs as appropriate, encourage hydration, provide assistive devices to promote independence and self-esteem, follow any bowel and bladder schedule, and encourage socialization to prevent depression. Here are some things to report to the RN regarding brain or spinal cord injury. Skin that is pale, red, or looks like the beginning of a pressure injury, joints that do not move as easily as they once did, complaints of burning on urination, frequency with urination, or urine that is foul smelling, and any change in level of patient consciousness.